Welcome. This video will master cyanotic heart diseases, a crucial topic for nursing officer exams. We will cover the 5 teraseconds, assessment, and nursing management. The core concept to remember is shunting. Cyanosis indicates a right-to-left shunt, where deoxygenated blood mixes with systemic circulation, resulting in a blue baby. We classify cyanotic heart diseases using the, quote, 5 teraseconds mnemonic. These are tetralogy of Fallot, transposition of great arteries, tricuspid atresia, truncus arteriosus, and total anomalous pulmonary venous connection. What is the most common cyanotic heart disease in children beyond infancy? The answer is tetralogy of Fallot, or TOF. Tetralogy of Fallot is a combination of 4 defects, often remembered by the mnemonic RAPS. These include right ventricular hypertrophy, aorta overriding, pulmonary stenosis, and a septal defect, or VSD. In TOF, severe pulmonary stenosis raises right ventricular pressure, causing a right-to-left shunt through the VSD. This sends blue blood to the aorta, resulting in systemic cyanosis. Clinical manifestations include cyanosis that worsens as the ductus arteriosus closes. Patients also experience TET spells and a systolic murmur due to pulmonary stenosis. A key diagnostic sign on a chest X-ray is the, quote, shaped heart. This is due to right ventricular hypertrophy and a concave pulmonary segment. Which position provides immediate relief during a TET spell? The correct answer is squatting, or the knee-chest position. TET spells are hypercyanotic episodes triggered by crying or feeding. Squatting increases systemic vascular resistance, pushing blood back into the lungs to alleviate hypoxia. Nursing management for a TET spell prioritizes the knee-chest position immediately. Other steps include calming the child, administering 100% oxygen, giving morphine, and providing IV fluids. Surgical management includes the palliative Blalock-Taussig shunt to temporarily increase pulmonary blood flow. Total correction involves VSD closure and resection of the muscle in the right ventricular outflow. The question asks what is not a component of tetralogy of Fallot. Pulmonary stenosis, right ventricular hypertrophy, and overriding aorta are components. The answer is atrial septal defect. Transposition of the great arteries, or TGA, is where the main arteries are swapped, creating 2 parallel circuits. This is life-threatening unless a mixing defect exists, and cyanosis is immediate at birth. The diagnostic sign for TGA on chest X-ray is the egg-on-string appearance. This is due to a narrow mediastinum and a globular heart. The immediate medical goal is to keep the ductus arteriosus open. Prostaglandin E1, or PGE1, is administered to prevent its closure, allowing blood mixing until surgery. The egg-on-side appearance is seen in transposition of great arteries. Tricuspid atresia is the absence of the tricuspid valve, meaning no blood flows from the right atrium to the right ventricle. Survival requires ASD and VSD, or PDA. Treatment involves the Fontan procedure. Total anomalous pulmonary venous connection, or TAPVC, is a defect where pulmonary veins connect to the right atrium instead of the left. This results in the snowman sign, or figure of 8 feet on X-ray. Clubbing, the bulbous enlargement of the distal fingers, is caused by chronic hypoxia. Signs include loss of the nail bed angle and a positive Shamroth's window test. Polycythemia is a compensatory mechanism where the body produces more RBCs due to low oxygen. This thickens the blood, increasing the risk of thrombus formation. Hydration is crucial to prevent clots. Digoxin is used to increase contractility. Crucial nursing rules include checking the apical pulse for a full minute and monitoring potassium levels, as hypokalemia increases toxicity risk. Early signs of digoxin toxicity are GI symptoms like nausea and vomiting. Cardiac signs include bradycardia and dysrhythmias. The antidote is Digibind, or digoxin immune fab. Furosemide is a diuretic used to remove excess fluid, but it can cause hypokalemia. Nurses should encourage potassium-rich foods and administer the drug in the morning. Preoperative nursing care focuses on conserving energy by clustering care and providing small, frequent feeds. Maintaining hydration is essential to prevent polycythemia-related clots. Postoperative care includes monitoring urine output, which should be 1 to 2 milliliters per kilogram per hour, and managing pain. Watch for excessive chest tube drainage, which may indicate hemorrhage. Children with congenital heart defects need infective endocarditis prophylaxis. Prophylactic antibiotics, such as amoxicillin, should be given 1 hour before invasive procedures, especially dental work. Sudden cyanosis and dyspnea while crying indicate a TET spell requiring immediate intervention. The congenital heart defect that results in a snowman appearance on chest X-ray is total anomalous pulmonary venous connection, or TAPVC. Before administering digoxin to an infant, the medication should be withheld if the apical pulse is less than 90 beats per minute. The primary cause of clubbing in a child with tetralogy of Fallot is chronic hypoxia. Indomethacin is contraindicated in newborns with duct-dependent cyanotic heart disease because it closes the ductus arteriosus, which must remain open for survival. A child with cyanotic heart disease is at increased risk for a neurological complication known as a brain abscess. For a quick revision of X-ray signs, remember, boot-shaped heart equals TOF, egg on string equals TGA, and snowman sign equals TAPVC. This slide summarizes the key defects we covered in this video. Remember the mnemonics, prove for the components of TOF, and that the knee chest or squatting position is the #1 intervention for a TET spell. Stay busy with your studies, and success will follow you. Success usually comes to those who are too busy to be looking for it. Thank you for watching. All the best for your exams.